Thanks very much. Good evening to everyone and good afternoon. I know we're all in different time zones in the country. It's a pleasure that you're all here with us today to join the program. I also wanted to thank Beacon. It's always a privilege to be involved with any activity related to Beacon. It couldn't be a more wonderful organization for patients and even healthcare providers. And I also wanted to thank Eric and Linda for being with us this evening. We're looking forward to hearing from both of you as well. Okay, so I'm just gonna, I'm also, Morgan is gonna kindly run my slides for me. So Morgan, next slide, please. Thanks. So I'm, as Dr. Schuckman pointed out, I'm going to kind of focus on 3 topics. So I'm gonna focus on when one has a urinary diversion, what impact does that have in one's overall kidney function? And are there specific alterations that can happen in your bloodstream, which is medically is referred to as metabolic and nutritional changes? And urinary tract infection, that's always a common topic that everyone asks about and wonders about, am I prone to urinary infections? And if so, what are the consequences to me? And kidney stones or forming stones in the urinary diversion, does that happen? And why does that happen? Next slide, please. So I'm going to get started with kidney function. It's very well known that regardless of who you are in the population, men and women, as we all age, unfortunately, our kidney function declines. It's a process of aging. Certainly common health conditions like high blood pressure, diabetes, certain medications we might be on can impact our kidney function in a negative way. It's known that in the United States and worldwide, men and women over 70 years of age achieve a definition where there is some degree of kidney impairment in at least 50% of people in the population. So we know, again, as we age, our kidney function declines, and that's a fact of life. Well, what about if you have a urinary diversion? It's kind of been an age-old question that does your worsening of kidney function, is that expedited because you have a urinary diversion? Is my kidney function going to be worse? The reality is we don't really know the absolute answer to that, but the majority of medical studies that have been done in this field demonstrate that probably not, or there might be a slight worsening of kidney function if you have a urinary diversion compared to others in the population of the same age group, same health condition. So overall, I think kidney function is relatively stable if you have a urinary diversion relative to others. But one thing that's very important to recognize is that problems of a urinary diversion, like obstruction, maybe because of the stricture, like Dr. Schuckman pointed out, where that ureter was sewn into the urinary diversion. So if that causes a blockage, that can impair kidney function. Things that I'm going to talk about, stones, urinary infections, metabolic changes, these can negatively impact our kidney function. So certainly if you develop problems of a urinary diversion, this can harm your kidney function more so than just the process of aging. Next slide, please. Well, what are some of these metabolic and nutritional changes that can happen? Well, a urinary diversion is made out of a piece of bowel, whether that's the use of ileum, the colon. It's very different than the bladder we're born with. The bladder is impermeable, meaning it doesn't absorb anything. When the kidneys process our bloodstream, dump the things that our body doesn't want and turns it into urine, and that comes down to the bladder doesn't reabsorb anything. It's impermeable. But obviously bowel is the opposite. Its function in life is to absorb things. So when the kidneys process things from our bloodstream, create urine, put it down into our urinary diversion, there's a possibility and good likelihood that some of these constituents are being reabsorbed into our bloodstream. One of the consequences of this might be a negative consequence is things that normally wouldn't be absorbed from the bladder we were born with, can lead to acidosis in the bloodstream. That's a condition that can lead to certain symptoms that we might experience. It can also change our bone health. It can lead to us having some loss of mineralization of our bone. So there can be some consequences. Now, what are some of these symptoms? Well, they're vague, and we often wouldn't know that this is due to acidosis in my urinary diversion. Symptoms in life of I'm feeling tired or lethargy, or my appetite isn't so good, anorexia, or I just feel weaker, muscle weakness. These can possibly be symptoms of acidosis. Often, though, as part of your normal health exams, the blood test will demonstrate that you have signs of acidosis, and usually your physician will recognize this, and it's very easy to correct before you have any symptoms. And most of the time, you don't have symptoms. When your healthcare provider finds that there's acidosis on a blood test, they can start you on a pill. Sodium bicarbonate is the classic pill that's used to correct this acidosis. So it's very correctable. Often you won't have symptoms because it's recognized early, and the problem is solved fairly easily. Vitamin B12 deficiency. This can happen because of a urinary diversion. When parts of the bowel are used, especially when greater amounts of bowel are used, like a neobladder or an Indiana pouch, there might be a greater tendency to getting a vitamin B12 deficiency. Again, this is detected by your healthcare provider through a blood test. And so you can measure vitamin B12 levels. And if it's detected they're low, they're easily replaceable with options by taking a pill. There are options where you can put it under your tongue, or an intramuscular injection, which can be given once a month. But sometimes you can get pretty severe symptoms if you have a vitamin B12 deficiency. Not only can you feel tired, but more so you can have neurological problems, so nerve disturbances, tongue swelling. So sometimes it can be very severe. So important your healthcare provider recognize it and this be corrected. Next slide. So not only can metabolic problems happen because one has a urinary diversion, but urinary infection. It's common knowledge that a piece of bowel and bacteria live in harmony in life. Our bowel in our body is loaded with bacteria. They serve a very important purpose. They live in harmony with our body. But now we've taken this piece of bowel and we've created a urinary diversion from this piece of bowel. So now it's not uncommon that we find that there will be continual bacteria present in the urine with someone with a urinary diversion. That likelihood is greater if you have an ileal conduit when you compare it to a neobladder and even to a continent catheterizable pouch like an Indiana pouch, but it's very common to see bacteria. But the important point is we're always hopeful that the bacteria in a urinary diversion and our body are living in harmony with one another, that it doesn't lead to an infection, but for whatever reason, that balance or harmony is tipped, an infection can ensue. The bacteria can start to act up and a urinary infection can happen. And that can sometimes be pretty severe. It can lead to a kidney infection, which is called a pyelonephritis. It can get in our bloodstream. All of these are quite serious and can be harmful to our kidneys and harmful to our body. But the good news is, again, there's often bacteria in our urinary systems. They don't cause an infection. They're living in harmony with our body. But some of the time, the bacteria can tip the balance. We can get an infection. What's really important, though, is we have to be sure that there aren't problems of the urinary diversion that have developed that are contributing to why the bacteria are there, that it's not just a fact of nature, that it's just not a fact of having a piece of bowel in our urinary system, but rather there's a problem. And what types of problems am I talking about? Well, if there are stones present in your kidneys, stones present in your urinary diversion, bacteria love hiding in those stones. That can be a focus of the bacteria. There could be staples in your urinary diversion from the surgical construction. Obstruction can happen, like that stricture that Dr. Shookman pointed out, that blocks the kidney. Bacteria love that environment. So it's important that your doctor investigate, not if you've had one infection or the occasional infection, but if, whatever draws the suspicion of your physician or healthcare provider that the number of infections or the character of the infections or the frequency of the infections might lead to further investigation, looking for some of these findings. Are they present? They're often correctable to take away that risk of urinary infections. Next slide, please. As I mentioned, stones can be a problem. So kidney stones are a prevalent problem in the United States. We know that during times of warmer climates in the summer months, not drinking enough fluids, especially water, other types of dietary constituents, certain factors in our diet, we're prone to getting kidney stones. Well, if you have a urinary diversion, unfortunately, the rate of getting kidney stones is higher it's up to 15 to 20% over one's lifetime. And that's far higher than the average person in the United States of developing a kidney stone. Also, you can get stones within your urinary diversion, and it's much more common with a neobladder or an Indiana pouch than it is with an ileal conduit. An ileal conduit, it's very uncommon, but much more so, up to 15 to 20, up to 10 to 15% in a neobladder or an Indiana pouch, you might get a stone. Why is that? It's because some of these factors I'm talking about, the acidosis, pieces of bowel have been used, so that changes the constituent of your urine. Urinary infections can put you at higher risk of getting kidney stones. If you're not emptying your urinary diversion well and you're storing a lot of urine behind, your urinary diversion has a lot of mucus in it. These are all factors that can lead to the deposition of minerals in our urine, the formation of stones. So once again, if stones are forming, it's important for your healthcare provider to look into factors that are correctable. Are there things that we can identify about this urinary diversion or metabolic changes, correcting acidosis, that we can improve the likelihood that further stones won't develop? Because these stones that often develop, they have to be treated surgically, and we're hopeful that they don't happen again. And next slide. And I wanted to thank all of you for joining us this evening. We look forward to questions.